Hey guys, we're end of the day Friday, and for somehow everyone calls Friday Filler Friday, and we actually are doing fillers for acne scars today. We have one of my beautiful patients that had some pigmentation when she initially came in and also some acne scarring, so we pre-treated her with a peel that gave her a really significant improvement. Now we're going to step 2, where we're going to use some fillers to just plump some of the scars, and she really notices textural irregularities in the left side of her face more than the right. And specifically when we shine a side light, you can really see them much more dramatic. She has a beautiful heart-shaped face, so we want to keep that slender look by improving her texture. So let's see, shine us with the light here. We're going to take this one down. Turn your head to the right a little bit. Shine the light on the side. So if you guys see, look, when you shine the light, and this is what always happens, women get into the elevator, the overhead light, they get pissed off, they take a selfie picture, send it to me saying their skin looks terrible. When it's really not, it's just the lighting always makes all the imperfections shine out. So if you're gonna improve using fillers, we really need to shine at every angle. So shine on one side over here, good. And you can see she has some ice pick scars which we can treat separately using TCA cross or doing microneedling radiofrequency. Shine over on this side a little bit. But from this angle, right about there, you can start to see where she has a lot of these textural irregularities. So what we're gonna do is use a fine filler, little pinches, okay? I'm gonna try my best not to hurt ya, called Bellafill. And what this does, it goes right under the surface of some of those scars, and we deposit a little scaffold of this material, which is made of something called PMMA, or polymethyl methacrylate. If you read about this in Google, you're going to see all these horror stories of people getting terrible PMMA injections to the buttock. Now, this is not pure PMMA. That's either silicone or impure PMMA that's not coming from the United States, and these people are doing this in like back alleys or in hotels, which I would not suggest doing, especially in the buttock area. Here we're using real Bellafill, FDA approved for acne scars. I was one of the researchers for this, and it works very well. It does not have any side effects that I've ever had in my hands when you do a micro droplet technique, which is what we're doing right now. And I'm focusing the majority of the improvements for her on her left side because that's where we see the majority of her scarring. And I'll show you guys the right side in a second. We're going right underneath those scars. And the Bellafill needle is a little bigger, so I'm doing as gentle as I can. I'm sorry if I'm hurting, I'm trying not to.
That's fine.
You're doing great. We did a little bit of numbing. Good. Okay, so what we're gonna do now, let that settle down. Hold with your left hand and the ice. Yeah, that's good. Turn to the left. That's okay. Yeah, do that for now. Turn to the left. Now we're gonna go to this side. Now on this side, you can see not so bad, just way better. There's a couple ice pick scars, big deal. We can treat those in the future. So we're just gonna do a small amount. I don't want her to be perfect on one side and not perfect on the other. So we still will implant a little bit of the Bellafill scaffold. This interesting thing about Bellafill is that it's the only filler in the United States that still has collagen in it. So one of the things you must do before treatment is do a skin test. So that's kind of an important thing to know. If anyone tells you not to do a skin test with this filler, I wouldn't suggest that. Even though the rate is very low that people get allergic reactions, you wouldn't want to put something in your skin that has the potential for an allergic reaction years later. We don't want to do that. So that side looks great. That's complete. Went right under those. So I'm going to go have her hold with your right hand. Hold a little pressure right there. We're now going to go back to the opposite side. After I've done a couple, take that down. Go ahead. Perfect. After we've done a few needle pokes, we can see now. Shine for me a little bit. Smile for me. So why do I have her smile? Can you wipe a little alcohol?
Yeah.
Why do I have her smile? When scars come together, when you smile, it means they need volume. Okay, so we're looking to see when she's smiling, where are the scars coming together. Smile again. So you can see right in this crease right here, these little scars, they come nicely together. So we're gonna put a little bit in there. Okay, same thing right here, just a little bit right there. Good. Smile again. Great. It's hard to smile when you're getting poked 1,000 times, but I get it. I'm trying to be precise. I want to be very precise. Okay. So everything's looking really good. Relax for a sec. One more. Beautiful. Okay, so now ice pack on both sides. Want a nice pressure so she doesn't bruise. Hold the other side with the ice pack. And that's it. That's Bellafill for scars. And like I tell people, micro droplet injections, so we do this in a series over time. She may only need 1 to 3 treatments over the course of her life, because then she's going to build that collagen. It's going to stay there for long term, and then we can keep going with peels, skincare, at-home rolling, microneedling, or laser treatments to get more improvement. Thanks, guys.